this on this Friday night. A trifecta of states of emergency have been hit New York State, with polio now topping the list. This month, joining COVID and monkeypox.
News 10 ABC's James De La Fuente has the latest details on the new declaration from Governor Kathy Hochul.
I don't think we should panic.
Polio is the latest medical concern to hit New York. Currently, there is only one documented case in Rockland County. But officials say they have now detected the virus in wastewater in 4 New York counties and the city. The biggest concern among local physicians is a delay in completing the polio vaccine series. Some kids are behind because of pandemic quarantines over the past 2 years.
You only need 4 to be fully vaccinated, but kids are missing their shots.
A simple solution, he says, is to make sure you're up to date with your doctor and recommended vaccines. Executive Director of Ten Broeck Mansion and local historian Catherine Costo says when Americans took new sanitary precautions in the last century, that inadvertently ushered in disease.
The child bathrooms that we associate with the early 20th century, those were creating a cleaner and cleaner environment, so young children were not naturally exposed to very, very low levels of the polio virus.
The New York Department of Health saying the following New Yorkers who have previously received their full vaccination for polio should get a lifetime booster dose. Individuals who have had close contact with a person known or suspected to be infected, or such person's household members or other close contacts. Healthcare providers working in areas where polio virus has been detected, such as the Rockland, Orange, Sullivan, and Nassau counties, and New York City. Those who might handle the specimens that might contain polio viruses or treat patients who might have polio. Finally, individuals with occupational exposure to wastewater can consider a booster. The statewide average of vaccination is nearly 80% among children who have received 3 polio immunizations before their 2nd birthday. The New York Department of Health is hoping to achieve a rate of well over 90%. New Yorkers should know that hand washing is important with soap, but those alcohol-based sanitizers we're using will not work on some types of germs, such as polio. Kids are most likely affected as most adults are vaccinated.
Most of us, certainly in the past 40 or 50 years, we've been very diligent about giving the polio vaccine.
And the governor's declaration will remain in effect until October 9th. Reporting in the studio, James De La Fuente, News 10, ABC. Back to you, John and Lydia.